All right, let's continue our discussion on lifespan development. And let's first focus on what happens to mom during pregnancy. Men, gentlemen, boys, pregnancy is hard on a woman's body. It is very hard on a woman's body. And if you are with a woman right now and she is pregnant, I want you to take time to make her feel special. Give her some foot rubs. Go out of your way to do something special for her, because pregnancy is tough. And I don't care what you say, there is no equivalent for the male's body. Nothing like this ever happens to the male physiology. Thankfully, pregnancy doesn't occur very often to a woman's body because it is very tough on the woman's body. Some things that oftentimes occur during pregnancy for the woman include nausea and vomiting. This is very common during the first trimester. And even though it's called morning sickness, it's kind of a misnomer. My wife experienced what she referred to as all-day sickness. She was nausea and felt this nausea all the time during the first trimester, morning, evening, and night, and she'd even wake up in the middle of the night and feel nauseous. Sometimes mothers are going to have extreme nausea and will vomit every single day and actually have rapid weight loss during this first trimester period because of the extreme nausea. Sometimes moms will have an overall increase in energy and sense of well-being. These are the women that just love being pregnant. And many times this occurs during the second trimester. During the third trimester, as the uterus is pressing against the abdominal pelvic organs, many women will experience acid reflux and or constipation during pregnancy. There's also an increase in vital capacity. And this, what we mean by an increase in vital capacity, the woman is circulating more air into and out of her lungs. This is also going to correspond to the overall lung capacity decreasing because it's harder for her to inhale. So because she can't inhale and exhale as much, the ratio that she's inhaling and exhaling is going to increase, and her vital capacity goes up. That's kind of a quirk. Overall, the woman isn't going to be able to breathe in and breathe out as much, particularly in the third trimester. And then immediately after giving birth, many women will go, oh, I can breathe in again. It's wonderful. As the woman is experiencing rapid weight gain, there could be the development of edema in the lower appendages as lymphatic vessels were pinched off, and varicose veins can develop oftentimes in the lower appendages as venous return is pinched off in her body. Incontinence, or the inability to keep urine in her urinary bladder, is not uncommon for females. The placenta is also going to produce a wide variety of hormones, or protein-based hormones, that make cells resistant to insulin. In other words, many times females are going to have pregnancy-induced diabetes, particularly during the third trimester. The rapid growth of the abdomen and potential edema of the lower appendages can oftentimes cause stretch marks to develop in the woman's body. Melanocyte activity, the pigment-making hormone in the skin, sometimes will also increase during pregnancy. That forms a structure known as the linea nigra on the woman's stomach, and that's a darkened line that will typically go from the navel or the belly button and head down into the pubic region. There's also a hormone, one of the peptide hormones released is known as relaxin, and relaxin is a hormone that causes the ligaments of the woman's body to stretch out. And as these ligaments stretch out, many times her joints become extra loose, and the woman is sometimes develops what is known as SI pain, or sacroiliac joint pain. During the birthing progress, we find that the labor for the woman is going to be characterized by a contraction. And contraction is a tightening of the uterus. And this tightening of the uterus, for lack of a better description of what it kind of feels like, would be like when you clench your abdomen because you're pushing feces out. You're going number 2. And that's a bad analogy, but that's the best analogy I can give right now. And this tightening of the uterus occurs every 15 to 20 minutes and lasts about 40 seconds. That's going to be the onset of true labor. And the very first stage of labor is known as effacement. And this is when our cervix is thinning and there's cervical dilation. We have early labor and late labor. Early labor is when we go from maybe half a centimeter of dilation all the way up to maybe like 6 centimeters of dilation for the woman's cervix. And this takes time. Some women, particularly for the early pregnancies or for like the first or second pregnancies, this can take 24 to 30 hours to occur. Late labor or active labor, generally speaking, is going to be the rapid changing or dilation of the cervix, and this is going to typically be from like 8 centimeters of dilation to 10 centimeters of dilation, and this takes place rather rapidly. During stage 2 of the birthing process, we're going to have uterine contractions occurring every 2 minutes. And these uterine contractions are going to last for a minute in length. So we've gone from uterine contractions occurring every 15 to 20 minutes and lasting for less than a minute. Now these uterine contractions are occurring every 1 to 2 minutes and are lasting for 60 full seconds. During this stage, the woman is now actively going to start to push the child out. Sometimes there's going to be a slice from the posterior of the vaginal opening down through the labia minora, through the perineum of the woman's body. And this is known as an episiotomy and makes it easier for the woman to push the baby out. Generally speaking, episiotomies are frowned upon because it's slow. Episiotomies, if they're sliced, have a slower rate of healing compared to if the child is actually forced out and there's tearing that occurs naturally, even though that natural tearing is much scarier sounding for the woman. Once that child is born, the umbilical cord needs to be snipped and tied so that the child does not lose blood from their umbilical cord. It takes some time for the blood vessels of the umbilical cord to clot and fuse, and that's why we need to tie off the umbilical cord right away so the child doesn't bleed out from those major blood vessels. And then during stage 3 of the birthing process, the afterbirth needs to be delivered. This afterbirth is also known as the placenta, and this can take as long as 15 minutes for it to come out. Many times there will be a fundus massage where the fundus of the uterus will be massaged for the woman immediately after she's given birth to the child to help push the afterbirth out. Sometimes the physicians will actually reach up into the uterus and pull on it, tug on it a little bit to help pull that placenta out. So here's the first stage of birth, the birthing process. The uterus is going to start dilating, and many times the amniotic sac ruptures. In other words, the woman's water breaks. During the second stage, she is fully dilated to 10 centimeters, and she is pushing that kiddo out. And during the third stage, the placenta, or the afterbirth, comes out. To give you an idea of how big the placenta is about twice the size of your hand. So it's remarkably large. Here you can see a newborn infant, and look how large the placenta is in relationship to that newborn infant. It's a significant structure. As we go through aging, we'll start off as an infant, we'll end up as a toddler or a kid, then we go to adolescence, then we become adults. And there are several different hypotheses associated with why we age. One of them is going to focus on the cells. Our cells can change as we age due to hormonal and or genetic influences. One active theory of aging focuses on the shortening of the ends of the chromosome, the ends of the telomeres for our cells. Another theory of aging involves the looking at our mitochondria and how active our mitochondria are, or how many calories we consume. There is a group of people that believe that restricting calories will help make them live longer. And this has definitely been the case in lab rats. When lab rats are on a reduced calorie diet, they live a longer, healthier life compared to lab rats that are on a full calorie diet. We also find that a theory of aging is going to be related to damage accumulation. The more time we spend on planet Earth, the more time we have to get hurt, to have damage built up, or tissue damage built up. Some of it's avoidable. For example, you could choose not to smoke cigarettes. Some of it's unavoidable, though. Let's say you were in a random accident. But this damage builds up over time and causes your body to age. As we age, our skin becomes thinner, less elastic and dry, and more prone to tearing. We also have less adipose tissue under our skin, or our hypodermis, generally speaking. These two things combine to cause older individuals or more aged individuals to, generally speaking, have wrinkles appear. But primarily, though, one of the very noticeable spots that the adipose tissue is removed from is the buccal fat pads, or the cheek fat pads. Young people are characterized by having fat on their cheeks, and geriatric individuals are characterized by not having fat on their cheeks. We also have decreased activity for most melanocytes, causing the skin to not be as pigmented, the hair to lose pigmentation, but occasionally the melanocytes in random regions, or seemingly without rhyme or reason, will become overactive and leave liverworts or age spots or dark spots on the skins. Our heart becomes smaller and less active, and the arteries become more rigid and less elastic as we age. And our sensory perception, our nervous system, rate of reaction slows down, and we are not able to perceive the outside world. Our senses become more muted. Generally speaking, as we age, the body systems do not work as well. So our lenses in our eyes lose the ability to contract and relax or flex. They lose the ability to accommodate. Blood pressure goes up as our arteries lose the ability to flex with changes in the heart rate. Our bone density will decline, muscle mass will decline. Many individuals, as they have a muscle mass decrease, will have a weight gain because those skeletal muscles are constantly burning through lots and lots of calories, and as they lose skeletal muscle mass, their basal metabolic rate will decrease, and they're also, generally speaking, going to be less active, or there'll be more inactivity. Females are going to undergo menopause, typically around ages 50 to 55, and males undergo andropause, which is a much more gradual process over their adult lifespan. But even though you're aging, you can still do some things to help yourself age gracefully. Those could be positive lifestyle choices, and also involve just taking care of your body in general. And that's all we have for this lecture recording. If you have any questions about this material, please feel free to post them on the class discussion board, shoot me an email, or swing by my office when you're on campus. Happy studies!